Good morning and welcome to the Take Your Life Back Today show. My name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and the host of this show, the Take Your Life Back radio show, combined with the YouTube version video. Folks, let's talk about depression and addiction. Dual diagnosis. Everyone has bad days, whether it's because of problems at home, at work, in our relationships. We all experience down periods in our lives. For most people, the down periods come and go in a reasonable, ordinary fashion and can be remedied by things that make us happy. But those who suffer from depression, the emotional low periods don't go away so easily. Clinically, depression is a serious mental disability with severe consequences for the individual and his or her loved ones. Depression affects millions of people, keeping them from living normal, happy lives. The Center for Disease Control and Prevention, CDC, estimates that 10% of Americans suffer from psychiatric disorder. The following groups have the highest risks of depression according to the data compiled by the CDC. And they go as follows. Middle-aged adults between the ages of 45 and 64. Females, African Americans, and Hispanics. People who are unable to work, who are chronically unemployed. People who lack private medical insurance or public health benefits. Substance abuse is common among people who are battling a depressive disorder because alcohol is a central nervous system depressant. The use of this drug tends to trigger depression symptoms like lethargic, sadness, and hopelessness. However, many depressed individuals reach for drugs and alcohol as a way to lift their spirits or to numb painful thoughts. As a result, depression and substance abuse feed into each other, and one condition will often make the other worse, which is really a shame. When an individual has both depression and an addiction, it is called a dual diagnosis. A dual diagnosis can be made up of any combination of mental disorder like anxiety, depression, bipolar disorder, and addiction, drugs, alcohol, sex, and gambling. Dual diagnoses that include depressive disorders are among the most common forms of problems. In fact, the Journal of Clinical Psychiatry reports that 1 in 3 adults who struggle with alcohol or drug abuse also suffer from depression. Clinical depression poses a high risk of accidental injury, self-harm, and suicide. Depression can also suppress the immune system and weaken the body, making you more susceptible to physical ailments and chronic illness. When you add drugs or alcohol to the mix, the risks to your physical and emotional health increase rapidly. Enrolling in a specialized treatment program can help you avoid the devastating effects of depression and substance abuse and help you create the healthy, satisfying life you deserve. It is depression or just the blues? Could be a question some people ask. While most of us have been through periods of sadness, grief, irritability, or frustration, there's a difference between having clinical depression and suffering from a temporary case of the blues. According to the Diagnostic and Statistical Manual of Mental Disorder, 4th edition, clinical depression lasts for at least 2 weeks, interfering with your ability to work, maintain healthy relationships, and function socially, my friends. People with depression may experience 5 or more of the following symptoms on a daily basis. Possibly feeling of hopelessness, anxiety, loss of appetite, even weight loss, increased appetite, weight gain, sleeping too much or too little, tearfulness, aches and pains, loss of energy, feelings of guilt, sense of worthlessness, general irritability, difficulty concentrating on daily tasks, a loss of interest in activities or even hobbies, suicidal thoughts or suicide attempts. Depression frequently manifests itself in feelings of sadness, low energy, and hopelessness. However, some people, especially males, experience depression as a irritability, hostility, or anger. Regardless of how depression appears to others, it should be clear that the mental condition is different from individuals' usual emotional state. Feelings of grief or bereavement after a serious loss, such as the death of a loved one or the loss of a home, are not considered to be the same as clinical depression unless these feelings continue for more than 2 months. My friends, unlike clinical depression, a sad mood or a case of the blues probably won't interfere with your ability to go to work or pursue your usual activities. When you're depressed by the loss of a job or the end of a relationship, you can see a connection between the event and your emotions, and you know that this, my friend, this emotional state will come to an end after the crisis has been resolved. With clinical depression, the basic tasks of day-to-day life may seem impossible, and the mood seems permanent. Drinking heavily, using drugs, gambling, or having unsafe sex might seem like the only way to resolve the overwhelming pain and emptiness that you feel when you have a depressive disorder. A gateway to addiction sometimes does also come about. Depression is all too often a gateway into drug and alcohol use. It's easy to see why those who experience feelings of depression take alcohol and drugs in order to escape their negative emotions. But those who are clinically depressed are going to stay depressed if they do not seek treatment. And if these individuals are using drugs and alcohol on a regular basis, chances are their usage will soon turn into full-blown addiction as they continue in a vain attempt to self-medicate. My friends, the warning signs of addiction include the following, and pay attention to these. Tolerance, your body becomes accustomed to effects of drug and requires larger amounts to achieve the same effects. Withdrawal, if you reduce your intake of the drug, you experience physical symptoms like nervousness, nausea, tremors, cold sweats, or agitation. Remorse, you feel guilty or sad after you've used drug, even though you take the drug in order to feel better. Relapse, whenever you try to stop using the drug, cravings or withdrawals, the symptoms drive you back to your destructive habits. For some individuals who have depression and substance use disorder, giving up drugs or alcohol can actually make the depression worse. If you've been using alcohol for years, bury your depressive symptoms. You may find that your depression rises to the surface in sobriety. That's why it's so very important to receive integrated treatment for both depression and substance abuse at the same time. Without treating the depression that drives your addiction, or vice versa, you're likely to go back to your addictive behaviors or to experience a return of your depressive symptoms as soon as you finish rehab. In many cases, people who have depressive and substance abuse drop out of conventional rehab programs because sobriety is too much to handle without the right level of therapeutic support. Recovering from depression and substance abuse is important. What makes a dual diagnosis so hard to treat is that each disorder can intensify the symptoms of the other. Drinking excessive amounts of alcohol, for instance, is not going to make the depression better. In fact, it will make the condition more serious. And conversely, if a person is an alcoholic, their depression will likely keep them from attaining the proper mindset to overcome their addiction to alcohol. Folks, there is a high level of complexity involved in treating the dual diagnosis patient. It is a well-known fact that those who have a dual diagnosis will not get the care they need in a traditional, one-dimensional rehab program. Only those programs equipped to handle psychiatric problems as well as drug and alcohol addiction will be able to assist with the proper detox counseling and aftercare planning. An integrated dual diagnosis program incorporates counseling, peer support, education, and relapse prevention for both depression and substance abuse. According to the Substance Abuse and Mental Health Services Administration, an integrated treatment plan includes these goals. Now listen up, please. Helping the client understand the nature of depression, teaching the client that recovery from depression and addiction is possible, motivating the client to make major changes in his or her life, giving the client practical skills for handling negative thoughts, helping the client identify and change addictive behavior patterns. Medication therapy is a core component of recovery for many dual diagnosis patients who are faced with depression. Antidepressant drugs are help many individuals who have struggled with disorder cope with their symptoms and lead stable, fulfilling lives. Finding the right approach to pharmacological treatment can take time and patience, but with the help of qualified staff who are trained in dual diagnosis treatment, prescription drugs can provide valuable support. Support, encouragement, and motivation are essential tools in the battle against depression and substance abuse. Clinical depression can drain your energy and make you feel that rehab is a hopeless case. Individual counseling, peer group support, and family counseling can give you the strength you need to continue your recovery journey in spite of challenges and the challenges you face today and tomorrow. So where can you get help, you might ask? Foundation Recovery Network treatment centers in California and Tennessee understand the complicated nature of dual diagnosis. Every day, they welcome those who are struggling with depression and drug addiction into their facilities and start them on the road to recovery. At their three main centers in La Paloma Treatment Center, it's called the Kenyon Michael House. They offer a variety of programs that are designed to help their clients achieve sobriety and assignment to treat all occurring disorders. Call me at 844-405-HELP. Together we can help each other take our lives back. Be good to yourselves, be good to each other. Remember, simple smile to a total stranger can change that stranger's life forever, and even yours. Remember, it is very important that we get the treatment, proper treatment for a diagnosis of depression and addiction. May God bless each and every one of you. We'll talk to you guys real soon, like tomorrow. May God bless you. Take good care. And